Understanding Arthritis, your comprehensive guide. Hey everyone, Dr. Mike here, and welcome back to the channel. Today we're tackling a condition that affects millions worldwide, arthritis. Now I know the word arthritis might bring to mind images of grandparents rubbing their knees, but it's so much more than that, and it can affect people of all ages. We're going to break down the wall between you and a clear understanding of this complex condition. We'll explore the different types of arthritis, dive into their causes, and discuss the treatment options available to manage pain and improve quality of life. Whether you're personally affected by arthritis or just want to be more informed, this video is for you. Remember, knowledge is power. By understanding arthritis, we can take proactive steps to manage it effectively. So let's get started. Osteoarthritis, the wear and tear arthritis. Let's start with the most common type, osteoarthritis, often called wear and tear arthritis. Imagine your joints like the hinges on a door. Over time, with constant use, those hinges can start to wear down. That's similar to what happens in osteoarthritis. The cartilage, that smooth, slippery tissue that cushions your joints, starts to break down. This breakdown leads to pain, stiffness, and sometimes that dreaded grinding sensation. Osteoarthritis typically affects weight-bearing joints like your knees, hips, and spine. You know, those hard-working parts of your body that keep you moving every day. Think about it. Every step you take, every time you bend down, those joints are under pressure. Over the years, that pressure can take its toll. Now, while age is a major risk factor for osteoarthritis, it's not just a condition of aging. Younger people can develop it too, especially if they've had joint injuries or put excessive stress on their joints. The good news is there are ways to manage osteoarthritis and maintain your mobility. We'll talk about those strategies later in the video, but first let's move on to another common type of arthritis, rheumatoid arthritis. Rheumatoid arthritis, the immune system's misguided attack. Now, rheumatoid arthritis, or RA, is a whole different ballgame. Unlike osteoarthritis, which is caused by wear and tear, RA is an autoimmune disease. In autoimmune diseases, the immune system, which normally protects your body from invaders like viruses and bacteria, mistakenly attacks your own tissues. In the case of RA, the immune system targets the lining of your joints, called the synovium. This attack causes inflammation, pain, stiffness, and swelling in the joints. And here's the thing about RA, it often affects joints symmetrically. So, if one wrist is affected, the other wrist is likely to be affected as well. Over time, RA can damage the cartilage and bones within the joint, leading to joint deformity and disability. It's a serious condition that requires early diagnosis and treatment to manage symptoms and slow down joint damage. We'll discuss treatment options later, but for now, let's move on to another type of inflammatory arthritis, psoriatic arthritis. Psoriatic arthritis, more than just skin deep. Psoriatic arthritis, as the name suggests, is linked to psoriasis. Now, psoriasis is a skin condition that causes red, scaly patches on the skin. It's thought to be an autoimmune disorder as well. In psoriatic arthritis, you have both psoriasis and inflammation of the joints. So, not only are you dealing with the discomfort of psoriasis, but you're also experiencing joint pain, stiffness, and swelling. The joints most commonly affected in psoriatic arthritis are the fingers and toes, but it can also affect other joints like the wrists, ankles, and spine. One of the hallmarks of psoriatic arthritis is something called dactylitis, where an entire finger or toe becomes swollen, resembling a sausage. It's not a very pleasant experience, to say the least. Managing psoriatic arthritis involves treating both the skin condition and the joint inflammation. We'll touch upon some of the treatment approaches later in the video. But for now, let's move on to a type of arthritis that's known for its sudden, intense attacks, gout. Chapter 4. Gout. Even the name sounds painful, right? Gout is often referred to as the disease of kings because it was historically associated with rich diets and excess, and there's some truth to that. Gout is caused by a buildup of uric acid in the blood. Uric acid is a waste product that's normally filtered out by your kidneys, but sometimes your body either produces too much uric acid or doesn't eliminate enough of it. When this happens, uric acid crystals can form in your joints, triggering a gout attack. These attacks are characterized by sudden, excruciating pain, redness, and swelling in the affected joint. The big toe is the most common site for gout attacks, but other joints like the ankles, knees, wrists, and fingers can also be affected. Imagine the worst pain you've ever felt, and then multiply that by 10. That's what a gout attack can feel like. Thankfully, gout is treatable, and there are ways to prevent future attacks. Well, we'll delve into those strategies later. But first, let's explore a type of arthritis that primarily affects the spine, ankylosing spondylitis. Chapter 5. Ankylosing spondylitis, when your spine fights back. Ankylosing spondylitis, often shortened to AS, is a type of inflammatory arthritis that mainly affects the spine. In AS, the immune system attacks the joints in the spine, causing inflammation and pain. Over time, this chronic inflammation can lead to the fusion of the vertebrae, the small bones that make up your spine. This fusion can stiffen the spine, making it difficult to move freely. Imagine your spine slowly becoming less flexible, like bamboo gradually hardening. That's what can happen in ankylosing spondylitis. The pain and stiffness can be debilitating, making everyday activities like bending over or turning your head a challenge. While there's no cure for AS, early diagnosis and treatment can help manage symptoms, slow down the progression of the disease, and improve your quality of life. We'll discuss treatment approaches later in the video, but for now, let's move on to a type of arthritis that affects children: juvenile idiopathic arthritis. Chapter 6. Juvenile idiopathic arthritis, childhood arthritis. Juvenile idiopathic arthritis, or JIA, is the most common type of arthritis in children. The word idiopathic means that the exact cause is unknown, but it's believed to be an autoimmune disorder. Just like in adults, JIA causes inflammation in the joints, leading to pain, stiffness, and swelling. It can affect any joint in the body, and the symptoms can vary from child to child. Some children may experience mild symptoms that come and go, while others may have more severe, persistent symptoms. JIA can have a significant impact on a child's life, affecting their ability to play, participate in activities, and even attend school. Early diagnosis and treatment are crucial to managing JIA and preventing long-term joint damage. We'll discuss treatment options later in the video. But first, let's cover one last type of arthritis: infectious arthritis. Chapter 7. Infectious arthritis. When infection invades the joints, infectious arthritis, also known as septic arthritis, occurs when a joint becomes infected. This infection can be caused by bacteria, viruses, or fungi. Bacteria are the most common culprits, often entering the joint through an injury, surgery, or even through the bloodstream from another infection in the body. Infectious arthritis is a serious condition that requires prompt medical attention. The infection can quickly damage the joint cartilage and bone, leading to long-term complications. Symptoms of infectious arthritis typically come on suddenly and include intense joint pain, swelling, redness, warmth, and fever. If you experience any of these symptoms, it's crucial to see a doctor immediately. Early diagnosis and treatment with antibiotics are essential to clear the infection and prevent permanent joint damage. Now that we've covered the different types of arthritis, let's move on to the treatment options available. So there you have it, a comprehensive look at the different types of arthritis, their causes, and the impact they can have on your life. Remember, arthritis is a complex condition, and it's important to work with your doctor to find the right treatment plan for you. Whether it's medication, physical therapy, lifestyle modifications, or a combination of approaches, there are ways to manage your symptoms, slow down joint damage, and improve your quality of life. Thank you for watching. If you found this information helpful, please give this video a thumbs up and subscribe to the channel for more health-related content. And as always, stay healthy.